So in all of our markets, and specifically in the US, we run two sales teams. The first is what we call our capital sales force. They are working with hospitals and trying to incent and push forward a sale of the equipment, the capital equipment, that really allows them to begin their Da Vinci surgery program. And the sales force, the capital sales force, works directly with surgeons to communicate the value of the potential acquisition of equipment to the administrators who they work with. And with the administrators, you're really trying to serve two audiences: the CEO, who is investing on the potential of this and the vision, and the CFO, who needs to make the dollars and cents work. And so these capital sales force really also not only must work with the surgeons, but also work with the executive suite at the hospital, and that takes a pretty skilled salesperson. The second sales force we run, which is larger in scale, is the clinical sales force. They're adept at working with the technology in the operating room and helping surgeons by being product experts using the technology, and they're certainly trying to expand the use of the robot with more surgeons and more applications. So one sales force puts the razors in the hospital, and the other sales force incents the use of the razor blades of the equipment. So the sales cycle for the capital versus the clinical sales force that works with surgeons are different. The capital sales cycle is typically longer, although it can depend. If a hospital has no Da Vincis, then that can be actually pretty quick. If they realize they need one to attract the right surgeons, do better clinically in certain areas, then that could go quickly. Where it can become a longer sales cycle is the second or third system at a hospital. These hospitals have run a program maybe for 1, 2, 3, 4, 5 years. They're pragmatic, and often they have their own views of when they might need a system that may differ from their surgeons, who may want it quicker for their patients. And so those sales cycles can be longer. Second sales cycle is when we think of our clinical sales force. That is much quicker than the capital generally, and it's more specific. It really involves a clinical sales rep working with a specific surgeon and educating them on the potential benefits of robotics and finding if it's a fit for them. Do they believe in the potential benefits? Does their practice well suited to adopt it? And do they feel it's worth it to them? Do they think the benefits the patients could receive? Is it worth their investment in terms of their time? And it's really surgeon dependent, but it's typically faster than selling a piece of capital equipment to, say, the hospital CEO. So just deciding to acquire a piece of the equipment is not the end of the sales process. And once you acquire it, you need to also use it, right? And for a hospital that's invested, actually, the more they use it, the better the economics work for them to amortize the cost of the equipment and the service. And to do so, it takes tight collaboration between the capital sales force that helps put the system there and the clinical sales force that makes sure it's utilized most effectively. And they hold regular regional meetings, specific account handoff discussions. But that collaboration is crucial, but it's also difficult when you have sales force that are focused on different things. And really, we've got taking great strides there, but I think we can always do better there. And as we get bigger, it becomes more and more important to focus on process, not just saying that this is what you should do, but build process around it to make it happen.